Hello, thank you for joining us. I want to welcome you to eKlotho. We are a remote patient monitoring program where we provide to you a scale, a blood oxygenation that clips on your finger. We provide you with a blood pressure cup, and we provide you with a blood glucose meter. Along with that, we provide you with a computer tablet. What makes our program different at eKlotho is we've actually tied each device through a process called Bluetooth to connect to the tablet. So it's very simple. When one of our new members or patients stands on the scale, the results immediately go to the tablet. When you check your blood pressure, immediately records on the tablet. That tablet then is tied to Wi-Fi, where it uploads that data to a secured server where your primary care physician now has access to review your vitals, whether it's on a daily, weekly, hourly basis, depending on what you're doing and how often they want you to check. The other benefit is we can allow, if the patient or member allows it, to have the individual choose a family member that would actually have access, so they can help monitor their parents' vital signs as well and participate as a medical advocate if they desire. So the whole idea here is that very easily on a daily basis, we're going to capture your vital signs, your weight, your blood pressure, your blood oxygenation, and blood glucose if needed, where at any time your primary care physician can log into their doctor portal and actually see the results. We are the only company today utilizing this technology, tying multiple devices to a computer. So even if the internet is down, we're actually still storing all of the data on the tablet. Once the Wi-Fi comes back up, it's now uploaded and the most current information is there on the server. And joining us today, we have Dr. Charles Kim. He's a family practitioner, regenerative integrative medicine doctor, works in a lot of different areas. And Dr. Kim is involved with us as a medical director overseeing our program. And Dr. Kim, maybe you can share with our listeners today the benefit of the eKlotho remote patient monitoring to the doctor as well as to a patient.
Hi, I'm very happy to talk about today. This monitoring is very useful to patient and doctors. For example, say I take a lot of the patient who need medication for the hypertension, and then we give him medication, and then usually come back next week or 2 weeks later. But sometimes patient notice some dizziness, feeling not so great. Maybe medicine is not right for the patient, and sometimes in too high doses. But this monitoring is one of the most accurate blood pressure in check. For example, we have a patient came into the office, we call white coat syndrome, which is a patient came to the clinic, blood pressure elevated. So that is we have some time experience about it. They call white coat. So sometimes check your home more accuracy compared to the clinic office. I think this is a very useful for the patient, also useful for the doctors. And then you can contact your doctors concerning about your blood pressure is changing a lot after changing medication. So that is a very useful and I am happy to work together. Thank you.
Dr. Kim, maybe you can also talk a little bit about the importance for an individual on preventative to be checking these things. You know, once you become a certain age, it becomes more critical. There's benefit in knowing this information. That way you can have more intelligent information for doctor when the doctor's working with you.
Well, yeah. Also, for example, blood pressure is depend on the medication, depend on the conditions, all different. And then also we call just elevated blood pressure. And sometimes we don't need to medications. And then we recommend some supplement if they need it. Also exercise, body weight, and also the very important thing, if you lose body weight 10%, your blood pressure is going down quickly. So this item, we check about body weight, also blood sugar, and the blood pressure. It's a very marvelous item. We give you the provider patient, and then also benefit and the doctors and patient. We will see how you can try to use daily check. And also I recommend check almost same times. When you wake up in the morning, you can check fine. I don't want to check about today in the morning, tomorrow at the night, because the night and day, blood pressure is changing about 5 to 10 differences all the time. So daytime, little bit elevated, but when you wake up in the morning, 6 to 7 o'clock, whatever, we can check in the morning, is usually in the morning blood pressure much lower than daytime blood pressures. Also sugar too. Also the patient has a diabetic, non-diabetic, particular patient who takes some oral medication or insulin, blood sugar is very important because if too low, is more harm than benefit. So you have to be checking all the time blood sugar if someone has taken insulin or oral hypoglycemic agent. Most difficult one and the most dangerous situation is hypoglycemia. Sometimes blood glucose less than 60, and the patient started to shaking, also the cold sweat, and then we have to be action right away. Take a lot of juice and sugar, take it. That is the most important thing is the blood sugar check. So that is my comment.
Okay, well, great. Well, Dr. Kim, thank you for your feedback. And the bottom line is this: we've made it so simple for an individual to be able to check these vitals, make it available to their primary care physician almost immediately to be used for a number of different reasons, whether it's preventative, whether it's to help monitor their medication, or whether it's help to monitor a treatment that they need to go through. And so I urge you to get back to the individual that shared this video with you. Let them know how you can get started. And we look forward to joining you on your journey to wellness. Thank you.
Thank you.